From the foreign scene and of global focus is the breakthrough the world just achieved in regards to the COVID-19 pandemic. As at 18th of November, BBC News revealed that the Pfizer and the BioNTech, right, vaccine for COVID-19 is at 94% efficacy, while the race is on by world leading technology companies on viable vaccines. The Oxford vaccine named AstraZeneca, the Russian vaccine called Sputnik, are also showing promising results, about 90% of COVID, of the results. On today's fresh edition, we will be discussing the possibilities and the recent developments in Nigeria with reference to procuring this vaccine for the safety, protection, and prevention of Nigerians against the deadly virus. It will interest us to know that a Nigerian-born researcher named Dr. Oyema Ogugu, I hope I pronounced that one, is one of the leading scientists in the Pfizer team on the development of this groundbreaking vaccine. It is necessary for me to include that because, it's a Nigerian that is leading the research, force on that. So to discuss this topic with me, I will be interviewing our Honorable Minister of State, Federal Ministry of Health, to be precise. He was elected to the Lagos State House of Assembly in 1999 and was appointed as a speaker. Our guest was also elected to the Senate in April 2003 and re-elected in 2007. He has a long-standing history of patriotism and service to Nigeria. His political career dates back at 30 years ago when he was a national delegate for the National Republican Convention, NRC, in 1990. Going by his credentials, is our guest must, you guys must at least be guessing right at the moment. And your guess, I must say, is accurate by now. Our guest is none other than Senator Adeleke Mamora. Welcome, Honorable Minister.
Thank you very much. The name is Mamora.
Mamora, thank you. Thank you so much for that. Mamora. Oh, yes, thank you. I need to learn how to pronounce people's names. Yeah. It is indeed an honorable one to have you on the show today. First thing first, how are you, sir? Hope you're staying safe.
Yeah, one has been it's great. One has been keeping safe and keeping with what we have always advocated, non-pharmaceutical interventions, particularly the use of face mask, and then of course washing your hands several times in a day with soap and water, and where you don't have that readily available, using your alcohol-based sanitizer, and of course, which you can carry it in your pocket and all that. So you make it handy, and of course, keeping social and physical distancing.
All right, thank you so much for emphasizing on that again, sir. I would plead with you that you please kindly speak a little bit louder so that our audience can hear you better. Again, thank you for creating out time in your ministerial schedule to attend to my call and respond to the wishes of the citizens of our great country that you serve. It is good to know that you're staying safe and sound in this pandemic period. And as you've emphasized, we should keep to the WHO guidelines. Before we move into the discussion of the day revolving around COVID-19 and the anticipated vaccine, it is necessary I commend you, sir, and the Ministry of Health, including all the health workers on the management of COVID-19 thus far in our country during the first hit of the crisis. WHO commended our government and measures taken to curb the spread and minimize the fatalities and all. So again, excellent efforts and good works, Your Excellency or Honorable, for all the good work that you've been doing thus far.
Thank you very much. Kike, for your kind words. And, well, we're all in it together. It's all of government and all of society approach, regarding the response to COVID-19 pandemic. Thank you very much.
You're welcome, sir. So going straight to the business of the day, we are still very much in the COVID-19 era, and we still record cases of the virus in our country. We are being warned of a possible second wave by you. Could there be a potential second wave in Nigeria, sir?
Well, yes. Don't forget that what we are doing is relying on science, relying on data, relying on evidence. So it's a science-based issue. And we can see that at the moment, so a number of countries, of course, this is a pandemic, so it's global. In Europe, in America, you can see that they're already experiencing second wave. It's called. And of course, we are not immune. We are part of the global community. So what is happening in those other clients, we are not immune from same happening here. That is why we continue to warn and we continue to admonish people to keep to the non-pharmaceutical intervention and keep safe, no ramifications. Because I never fail to say that as individuals, we have the primary responsibility for our own health and well-being. So we are not immune to it. It can happen here, and that's why we continue to warn and alert our people to be careful, to do the things that we want them to do, especially by way of keeping to the non-pharmaceutical interventions. So it's a possibility that we also have that experience.
All right. So, sir, if you say that there is a possibility of second wave in Nigeria, can we infer that there could be another imminent lockdown in some states? Because how do we factor in the concerns and the disagreement of few that think that the previous lockdown was a punishment for Nigerians? Sir, I have engaged quite a number of people. Some people even believe that COVID-19 is not real. How do you tackle such?
Well, ours is to present the facts, like I just told you earlier on. Based on science, we present the facts. Based on data, we present the facts based on evidence. Science, data, evidence. So, those are the things we need to present to the people. And I just told you earlier on that it is now in the interest of everyone to take responsibility for his or her own health. That is the thing. But beyond that, we also have, as a government, we have a responsibility as well. That is what the Constitution demands of us. The Constitution says security and welfare shall be the primary purpose of government. That's under Section 14 of the 1999 Constitution as amended. So, that is what we are doing, is carrying out an assignment that is constitutionally placed in our hands. Now, having said that, it is also important to say that you mentioned the issue of lockdown.
Yes.
Lockdown is not something that you want to just do, but if the circumstance or the situation dictates, and we have no choice, it is not something we want to do, because when you do lockdown, it affects the economy, it affects everything. But you must be alive first to be able to enjoy the economy or to be able to even do anything. So that is why it is important for people to keep to the advisory which we give concerning this COVID-19. Of course, in some of the clients, even in UK as we speak, they have lockdown. In some states in the United States of America, lockdown is being contemplated, if not already put in place. So we have to wait and see how people respond to the advices they are giving.
All right. Many thanks for that submission, sir. Listening to you, sir, Honorable Minister, at a point in time, Nigeria was in talks with Russia on the said vaccine in their own country. So do they have a vaccine? Is my first question. One, what was the shape of negotiation between Nigeria and Russia on the said vaccine?
Well, contrary to the information that was put out then, which was it was a misinformation by a segment of the media.
Okay.
What happened was that the Russian ambassador to Nigeria visited us in the ministry just to give an information, just to inform us that they were already working on their own COVID-19 vaccine. And that they were pushing on to going into the clinical trials, or they had even started the clinical trials at the time of visiting. But that it was probably too early because they were yet to finish the whole process of testing of their vaccine. Because before you can say that a particular vaccine is in order to be applied, you must ensure safety, you must ensure efficacy of the vaccine. So at the time the Russian ambassador visited, they were yet to ascertain the efficacy. But just as a friendly nation, just to inform us that, look, we have this going on, and to just alert us, if at the end of the day, we would be interested. So that it was just a friendly gesture to give us information regarding what was going on then in their country, that is in China. As we have it right now, there are so many vaccine candidates, and from the literature, what we have there about almost 67 there about 70 vaccine candidates that are in various stages of clinical trial. When we say clinical trial, we have clinical trials in phases: phase 1, phase 2, phase 3. Phase 3 is the last stage, in which essentially what I mentioned earlier on, what the things being tested are safety, and of course the efficacy. That is how safe, because this is, when you apply vaccine, you have to apply it on a massive scale, and you want to be sure that what you are giving to people, you are administering on them, is safe. So the issue of safety is very, very important, very, very important. The second thing is how efficacious, that is, the vaccine, is it efficacious? Will it do what we expect it to do? And when you do all these trials, it is like trying to see, to measure, also establish these two factors, the safety, the efficacy. And of course, the other things that you want to find out, in clinical medicine, when you apply a drug or whatever, or even a vaccine, there is what we call contraindication. That is a situation that will not make it possible to apply that drug or that vaccine. So you want to establish all that. That is part of the safety thing. You want to find out whether there are side effects. If there are side effects, are they such that you can manage? Are they such that will be grievous? Are they such that will even lead to death or some kind of morbidity in the patient or in the person you are applying? These are all the things. All these are all the things under safety that you want to look at and establish before you want to come up with a position. Of course, the front runner in all this vaccine issue against COVID-19, we are the Pfizer vaccine, which you mentioned, that has been said to have efficacy of about 95%. Of course, we have the Moderna, which is also from the United States of America, like Pfizer's own. which is also said to have a efficacy of about 95% as well. Then, of course, the UK one from the Oxford University, AstraZeneca, which is said to have a efficacy of about 70 point something, about 70.4% and all that. So, and of course, the Russian one, which you also mentioned in your introductory statement, that is Sputnik, actually. Right?
Yes.
Russia, which is also said to be about 91.4% efficacious. So these ones appear to be the front runner at the moment. But again, it is too early for us to determine which one that we will go for as a country, because there are so many factors. Take, for example, one of these vaccines that was said to that there will be need to keep it under minus 70 degrees. So that's a tall order.
Okay, sir. So listening to you, sir, thank you so much for keeping us to speed regarding all the global research and regarding the success of the vaccine at the moment. I just need to ask are we anywhere close to having it for our citizens in few seconds, sir?
Well, it is probably too early. What I just know is that it's important to tell you is that we are part and parcel of the World Health Organization COVAX body. COVAX is a global collaboration which is geared towards development, production, and equitable access to COVID-19, whether testing, whether treatment or vaccine. So we are part of that global collaboration. And one of the reasons why we are part of it is to ensure that we benefit, that we are not left behind when it comes to having access to this vaccine when it's available.
All right. Thank you very much.
It's important to say that we have the BioVaccine Nigeria Limited, which is a joint venture between the federal government of Nigeria and Baker. But that has to do with vaccine preventable diseases that we already know, like tuberculosis, like the yellow fever, and then of course polio and all that. Those are.
Okay. All right. Many thanks for that. So let me use this opportunity to open our phone lines. Please join us by calling the phone line 0700 923 923 923. Again, 0700 923 923 923. And of course, you can send us a message on WhatsApp 0817 313 6193. Let's hear your perspective on the topic at hand. If you have questions for our guests, please go ahead and hit us with your queries and comments. So, sir, you appealed to the youth recently at a press briefing that our youth should stop crushing our medical supply stores. That is, destruction of these vaccines will render them ineffective, in some cases poisonous. What vaccines were you referring to, and what is the current condition of the vaccines being destroyed by the youths?
Oh, okay. Okay, we are referring then to the NSAS protest and the destruction of. We were talking about what I call the routine vaccines that we give for our routine immunization, and those include the vaccines for tuberculosis, for polio, for measles. Of course, the whooping cough, and the vaccine for those are the of course even tetanus and all that, because those are the childhood preventable, the vaccine preventable diseases. We have them. So those are the common ones which
all right, sir. Kindly hold your thoughts, sir. Hello, what's your name and where are you calling from, please?
My name is Adeleke Mamora.
Yeah, what's your contribution today?
Yeah, good day, Honorable Minister. Good day. Thanks for bringing the Honorable Minister on board for this discussion. I've been waiting for this call. What I want to say is this, sir. In terms of the two major prevailing, the most effective vaccines, the Moderna and the Pfizer, which are about 95% effective. And a study of probably what I read on Fox News was that Moderna seems to be better in terms of storage than Pfizer. Pfizer, like you said, it takes like minus 70 degrees Celsius for you to operate, for you to put it, and maybe cannot last more than a month per dose. Now, the first question is the logistics. Should this particular vaccine be finally approved by the FDA? I mean, that's American Federal Drug Agency. Should this be finally approved? So do we have intention to procure this and make it available for the public? Secondly, is the cost. The cost that I read up on Fox News stated that it's about $32 to $37, which is roughly about 15,000 of our cost per dose. A question which is crazy: will a dose be sufficient to keep people safely at that 95%, or you use more than that?
All right. Thank you for that.
Hello.
Yeah, go ahead, sir. Hello, sir.
Hello?
Yes, sir.
Okay. I hope I got the name right. Abayomi, thank you very much for your contribution and intervention. Well, essentially, I think Abayomi, you got it right. But that's why I said it's probably too early for us to determine which of these vaccines that we will go for. At the moment, we have set up a kind of vaccine task force on the COVID-19 that will advise us. You know, it's a group of eminent scientists and eggheads who are knowledgeable in this area that will look into our own situation vis-a-vis the vaccines that are available for COVID-19. We will look at issues of logistics, as Abayomi rightly mentioned, the issue of cost, and of course the issue of availability. So, of course, if you talk of cost, you will also be looking at the issue of affordability. Is it affordable to us to be able to administer on a mass scale? And of course, the logistics in terms of storage, which again Abayomi mentioned, and of course, is it available? Is it available? So that's why we have a committee in place right now as a task force that will look at all these issues and variables and be able to advise us as to which one to go for the benefit of our people. Don't forget that I did mention earlier on that part of the COVAX project of the World Health Organization is to be sure that we are not left behind, that we must have access, to these vaccines, whichever one we choose to use. We must have access to it so that we can also take care of our own people.
All right. Many thanks for that, sir. So, sir, you said that the country's current vitality rate is less than 1.8%. which is less than 2.4% fertility rate in Africa and 2.8% globally. Does that mean Nigeria has a relatively credible rating in the management of the COVID-19 pandemic?
Well, I think we while I don't want us to start beating our chest, I must say that we have not done badly. There's still much that we can do. Okay. But at the same time, our case fatality rate is low relative to what we experience or what we see in other climes, in other regions of the world. And of course, that is even generally across Africa. But in Nigeria in particular, our case fatality rate is under 2, it's about 1.8%.
Okay.
So, which means that what it does say is that if you have 100 cases, then it's bad enough to lose anyone. But we are saying that we will not lose anyone at all. It will be less than 2 outside, in 100. That's what it means when we talk of case fatality. So our goal is to keep it even below 1.